If you've been diagnosed with severe periodontitis, these are the three most common clinical signs of severe periodontitis: inflammation and redness, deep pockets, bleeding, and mobility. Also, many times patients report bad breath, which is quite common in patients with severe gum disease. Can we solve all these three issues and even bad breath after treating the patient for severe periodontal disease? The answer is yes. We can reduce inflammation and redness, stop the bleeding, eliminate the deep pockets, which are the main source of periodontal bacteria, and even improve the mobility. That usually happens 6 to 12 months after the treatment has been completed. In most cases, the bad breath is a compounding effect of both the severe periodontitis, the process of severe periodontitis, plus a tongue coating. The tongue can also harbor nasty anaerobic bacteria, the main microorganisms causing periodontal disease, which produce volatile sulfur compounds, will be the main responsible for the bad breath that many people complain when they have severe gum disease. So by eliminating those deep pockets, we're actually eliminating the primary etiological agent, bacteria, and also we are eliminating the source causing volatile sulfur compounds. So yes, we can definitely improve the halitosis, bad breath, when we treat the patient for severe periodontal disease. If you have severe periodontitis, you will notice that especially the front teeth are mobile. This is due to losing the supporting bone as a result of the generalized chronic inflammation that those tissues present. Patients prior to developing periodontal disease, they present a stage of generalized inflammation induced by plaque, by the bacterial biofilm. This is what we diagnose as plaque-induced gingivitis. There is no bone loss and the state of inflammation is reversible. Briefly, I don't want to go too long into this, but depending on the stage of the periodontal disease, that is the extent and the severity of the disease, depending on when you were treated, if you were caught at an early stage versus an advanced stage, you may have more or less bone loss. So we have 4 different stages of the disease, stage 1 through 4. Depending on what stage you were diagnosed and treated, you may present more or less attachment loss. When the patient starts to present what we call clinical attachment loss, we enter into the different stages of the disease, of periodontal disease, stage 1 through 4. Stage 1 is an early stage of periodontal disease where we see minimum attachment loss ranging from 1 to 2 millimeters. Stage 2 individuals present a bit more of a clinical attachment loss, 3 to 4 millimeters, and we consider the disease as moderate. Stages 3 and 4 are more severe forms of periodontal disease where we see over 50% of the bony support loss and clinical attachment loss over 5 millimeters, which means that the individual has pockets probing depths 6 millimeters and above. Stages 3 and 4 are more severe forms of periodontal disease where we start seeing patients losing their teeth. The American Academy of Periodontology has also stages. There are some gradings of these stages, 3 different gradings depending on the rate of progression of the disease, grade A, B, and C. Grade A being the slow rate of progression, grade B, moderate, and C, the rapid rate of progression. We see those cases in patients with aggressive periodontitis. So grade C will be used for patients with a rapid rate of periodontal disease progression and is categorized as a more aggressive form of periodontal disease. So just to give you an example, an individual diagnosed with stage 3 or 4 grade C, that would mean that that individual is expected to lose teeth more rapidly than a patient that has been diagnosed with a stage 1 grade A. If you caught the disease at a late stage, let's say stage 3 or 4, when the disease is more advanced, you are more likely to see after the initial therapy of scaling and replaning a more significant gum tissue loss. So the gum line is more likely to recede as a result of the lack of bony support, as a result of having a more damaged bony foundation. And this is typical again on stages 3 and 4. So if you caught the disease at an early stage, let's say stage 2, you are less likely to have papilla loss, you will have less bone loss. And so after the initial therapy of scaling and replaning, you will have less tissue, less papilla loss at the in-between spaces in between your teeth. You are more likely, therefore, to have larger in-between interproximal spaces after the treatment on stages 3 and 4. And this again becomes more obvious on the anterior teeth, both upper and lower front teeth. because of the already weaker bony foundation that our front teeth have. After treating the patient for severe periodontal disease, these are the 3 clinical signs that you should expect after the initial therapy of periodontal disease. First one will be reduced inflammation and redness of the gums. You should see your gums are looking healthier, more pink instead of bright red. You will see no bleeding when you brush your teeth, and in many instances we will be able to improve or reduce the mobility after the first 6 to 12 months of therapy. This doesn't happen right away. What you may also experience is an improved breath. Your bad breath will likely go away the moment a full mouth disinfection is performed. That means getting rid of those deep pockets as well as eliminating the tongue coating. Definitely a tongue scraper is a beautiful tool that you should use on a regular basis. A tongue scraper looks something like this and should allow you to reach back, all the way back in the tongue, and scrape towards the front, eliminating all that white coating that accumulates on the dorsum of the tongue. So use it on a regular basis every day, at least once a day before nighttime. Using a tongue scraper will significantly reduce the bacterial count coming from the dorsum of the tongue. After cleaning the dorsum of the tongue, additionally, I would highly advise you to rinse with warm water and salt for about 30 to 45 seconds after you brush your teeth. So the teeth that are more susceptible and prone to be lost as a result of gum disease, severe gum disease, severe periodontitis, are usually the lower anterior, the lower front teeth. That basically has to do with the already weak foundation that these lower anterior teeth have. So when a patient develops gum disease, those are the teeth that usually are the weakest, and the progression of the disease can lead to a faster inflammation, pocket formation, and tooth mobility. So if you have been told that you are about to lose your anterior teeth as a result of severe gum disease, think that we can actually stop the progression of the disease without the need of doing surgery. I would avoid doing surgery on all the front teeth. This is something that we can do with a good initial therapy of oral hygiene instruction and scaling and root planing. A good initial therapy of oral hygiene instruction and scaling and root planing can actually save your loose front teeth, so you don't need to extract them. So the main benefits of the initial therapy of periodontal disease is basically that you can save those loose front teeth. This is the case of a patient with severe periodontal disease that came to my office complaining about bad breath, loose teeth, generalized gum inflammation and bleeding, tooth mobility. The patient was concerned about losing his front teeth even though he knew that all his teeth were affected by severe periodontal disease. You should always remember that when treating severe periodontal disease, the treatment should be done full mouth as a unit, a full mouth disinfection protocol, not just only one section. That will not work. The mouth is a unit. Research has shown that the bacteria, different bacterial profiles, have the ability to commute, basically take the bus and commute from the lower teeth to the upper teeth and so forth. They can use the saliva as a vehicle to travel within the mouth from tooth to tooth. Many of these bacteria also have the ability to invade soft tissues. So even after the treatment for periodontal disease, they can actually stay in our mouth for a long period of time. That's why we have to, on a regular basis, do maintenance and control those areas that could be at higher risk of developing deep pockets again in the future. Just think about this for a minute. Our mouth hosts a very dynamic microbial community of over 700 bacterial species and viruses such as herpes viruses that can actually also influence the balance of this delicate ecosystem. The ecological equilibrium between the good and the bad bacteria is what determines our oral health. So this is key to understand that delicate balance between the good and bad is the key for oral health. We call it a healthy symbiosis between the good and the bad bacteria, where the good bacteria keep the bad bacteria under control and they live in relative harmony. When this state of symbiosis or relative harmony breaks down as a result of you getting sick or not brushing your teeth or having poor nutrition or simply taking systemic antibiotics, that delicate state of symbiosis can change to a state of dysbiosis, in which the bad bacteria can take over and start multiplying, overgrowth, and take over this delicate ecosystem, leading to disease, to, for example, periodontal disease or tooth decay, caries, dental caries. bacteria. This shift in the delicate microbial balance that will lead to the overgrowth of bad bacteria and viruses is what actually can cause periodontal disease. And so we know that patients with past history of periodontal disease, for example, are more susceptible. They have a more delicate ecological balance between the good and the bad bacteria. That's why maintenance is so important on those patients with past history of gum disease, of severe periodontal disease. So these are the three things again that you will see after the initial therapy of severe periodontal disease. You should see a reduced inflammation and redness of your gums, that is healthier looking gums. You should see no bleeding, and your breath should smell better. The most important thing is that we'll be able to save those loose teeth, especially the lower front area, and improve the overall health. My recommendation is always to try to avoid gum surgery on the anterior teeth. That is why a good initial therapy is key. That is oral hygiene instruction and scaling and root planing. A good dental hygienist will help us get your front teeth under control, therefore avoiding surgery. For the posterior teeth, the clinical scenario is slightly different because of the anatomy of the posterior teeth. In many instances, we will find ourselves having to do pocket reduction surgery, gum surgery, to eliminate those deep pockets and correct the bony defects. However, for the anterior teeth, we always want to try to avoid doing surgery. That may not always be the case, but most of the time we will be able to solve most of the problems on the anterior teeth with basically a good initial therapy of oral hygiene instruction and scaling and root planing. If a first round of scaling and root planing didn't achieve the job of eliminating fully the deep pockets on all the anterior teeth, many times I advise a second round of scaling and root planing, basically to avoid doing surgery on those front teeth. The moment we do surgery, we're more likely to get attachment loss on an already weak foundation. The role of our dental hygienist is key here in eliminating those deep pockets after the scaling and root planing. So we should expect in most cases a reduction of those deep pockets, reduction in probing depth, inflammation, bleeding, and mobility after scaling and root planing. So this is a case that had severe periodontal disease. The patient was told that he was going to lose all his front teeth, those the 4 incisors. After the initial therapy of scaling and root planing, we were able to stabilize the situation, get rid of the inflammation, the deep pockets, the bleeding, and even the mobility improved after the first 6 months of therapy. You can see a significant shrinkage of the gum tissue, but they look healthier. There's no more pocket formation, and we did not have to do any surgery on these teeth to save them. Only by doing that initial therapy of deep cleaning, that is the non-surgical treatment, we were able to save those teeth for good, eliminate the inflammation, the deep pockets, the bleeding, and we also eliminated the patient's bad breath. So if you're a patient that you've been told that you're going to lose all your front teeth, this is a likely clinical scenario that will help you understand what to expect after the initial therapy of periodontal disease. My recommendation again is avoid surgery for the front teeth and do pocket reduction procedure for the posterior teeth if the patient presents severe periodontal disease. Sometimes we'll have to do bone regeneration procedures on those patients that present severe gum disease as a result of the bone loss present. Those are again usually more common on the posterior teeth. Think that when you have severe periodontal disease, when you chew or brush your teeth, you're actually favoring the shedding of bacteria into the bloodstream, and that could actually damage the cardiovascular system. If you have untreated periodontal disease, every time you eat or brush your teeth, the anaerobic bacteria that causes gum disease can actually travel into the bloodstream and cause other distant problems. There is a systemic risk, and so these bacteria are a risk for the cardiovascular system, the respiratory system as well, and has been associated with coronary artery disease and cardiovascular health. There are a number of systemic diseases that can worsen as a result of untreated severe periodontal disease, such as diabetes mellitus, type 2, cardiovascular disease, respiratory diseases, and rheumatoid arthritis, among many others. So treating and eliminating severe periodontal disease will improve your overall systemic health. Keep that in mind. It's not only about your bad breath, but about your systemic health. If you have severe periodontal disease, look for a board-certified periodontist that can actually diagnose and treat your disease in a short period of time. If you have any questions or comments, please don't forget to subscribe.